Hi y'all, my name is Claudia Lennhoff and I'm the Executive Director of the Champaign County Healthcare Consumers, and I am once again joined by
Adani Sanchez. I'm the Client Services Coordinator here at Healthcare Consumers.
And we are here for our Healthcare Fact Chat, and today we will be talking about the healthcare bill that is in the Senate. And Adani, after the House passed their amended American Health Care Act, we heard a lot about that the Senate was going to start working on their health care bill, but that they were basically going to be starting from scratch. They basically said the American Health Care Act was dead on arrival. So what's happening?
Spoiler alert, it looks very close to, if not exactly the same as the American Health Care Act. It still includes Medicaid caps, it includes very reduced tax credits, and it's still a huge tax cut for high income earners, and still includes some consumer protections that are being undermined. So it's very similar to the American Health Care Act.
Yeah. But nobody's had a chance to read it because it's being done in secrecy, right?
Yeah, no one is being allowed into these conversations. It's a working group of 12 GOP senators, no women. Yeah. And we aren't actually able to see this. The CBO is getting bits and pieces of it as it's being written by the senators. And so the CBO hasn't even actually seen the whole thing altogether, just a little bits and pieces of language.
So from an advocacy perspective, this is something of tremendous concern because much like the House, this is a bill that's being crafted in secrecy, and we believe that when they are ready to vote on it, that we will have very, very little notice to be able to see the actual bill and be able to review the CBO score. So we really want people to pay attention to what's happening in the Senate and stay tuned, and we'll talk about taking actions a little bit later, but you don't have to wait until the bill is presented to start being active on this. So let's talk about what we do know.
Yeah, what we know is that they're still looking at putting a cap in Medicaid. So they're still looking at per capita caps for people on Medicaid. Do you want to explain a little bit more about what that would do?
Yeah, so it's really important to understand that the American Health Care Act passed by the House of Representatives basically devastates the Medicaid program, both the expanded Medicaid that happened under the Affordable Care Act, but also the long-running existing Medicaid program that was created in 1965. Now, our understanding is that on the Senate side, because there was so much outcry against ending the Medicaid expansion, the Senate is still going to end it, but they're going to delay ending it by 7 years. So that's one way that they're winning over some of the senators who were opposed to the ending of the Medicaid expansion. Now that still means that people will lose their health care in 7 years or less, depending on what the rules are around that. The other thing that they're doing is that they are proposing still to place the per capita caps on the Medicaid program, and we did a whole video on Medicaid and per capita caps. What you need to know is that any version of a per capita cap means that every single state in the nation will lose Medicaid dollars. They will only have a finite amount of Medicaid dollars, and it will be less than what they currently get. There will be no state that wins with a per capita cap on Medicaids. Basically, anytime that you hear about per capita caps, you need to think of it as cuts to the Medicaid program, and our state would certainly lose out. And that's a big part of the Senate's health care bill, but they are winning over some senators who had previously been opposed to the cuts in Medicaid. They're winning some senators over by negotiating what's called the growth rate, which is how quickly the Medicaid funds can increase due to inflation or whatever. It's still a cut any way you slice it, and all states will lose Medicaid money.
Yeah, so that actually is really funny because they're delaying it so that those senators who are struggling to vote yes or struggling to get to a yes, so that they can go past their reelection years. So this is definitely a very strategic move for these senators to protect them from suffering the consequences of this very devastating blow, where people will still lose insurance through through ending the Medicaid expansion, and then states are going to be losing money through these per capita caps.
So it's still a death sentence for Medicaid and for Medicaid expansion. It's just put off a few years.
Yeah, and then they're also looking at possibly increasing the tax credits. The American Health Care Act kind of set tax credits into a very rigid state, and so the senators have expressed an interest in increasing the tax credits. However, they will not have enough money, because they still want to give that really big tax break. They won't really have enough money to keep people from getting off of health insurance coverage through the marketplace, because they don't have enough money to actually pay their premiums. It's still not gonna be enough to save people from getting off of the coverage, which is really a little what's the point of trying to increase these tax credits if people aren't going to want to stay on? And another thing that they're using as leverage, so they have decided that they're not going to take out protections, or they're not going to let states apply for waivers to charge sick people more. So now a state cannot apply to let their insurers charge sick people more.
So in other words, they're going to retain what's called community rating for the pricing of health insurance. Without community rating, the other option is experience rating in health insurance pricing. And what that does is it sets the price for health insurance based on a person's experience, meaning their health history. And that's one of the ways that people with pre-existing conditions can be charged a lot more for health insurance. So what the Senate is saying is that they will retain the community rating in order to help keep the prices affordable for people with pre-existing conditions. But there's a catch.
Yeah, so the catch is they're still going to allow states to apply for waivers to remove essential health benefits, so that they don't have to cover that set of services that we established in the ACA that are kind of things that have to be covered if you're going to sell an insurance plan on the marketplace.
And a lot of the healthcare policy people believe that what will happen is that by retaining community rating but allowing states to apply for waivers to change the essential health benefits, you could end up with insurance plans that, for example, are affordable on a monthly basis but don't include certain types of coverage. For example, health insurance plans, if they're in a state that has a waiver, could exclude maternity coverage, or could exclude mental health coverage, or substance abuse treatment coverage, or labs, for example. And so those monthly premiums might be more affordable to somebody, but they will have a less complete package of coverage in health insurance. And in order to access that other kind of health care, they're going to have to pay for it completely out of pocket. So it really doesn't protect people financially, including people with pre-existing conditions.
That's exactly what I was going to say. This is still targeting people with pre-existing conditions. This making sure to take away the portion where you can charge people with pre-existing conditions more is not the end all be all. You're still hurting people with pre-existing conditions who need lab services, who need these regular visits to the doctor, or maybe mental health specialists. So you're still hurting them in a big way.
Yeah, they're basically just trying to move some pieces around, and it's sort of like it's very deceptive, basically. But they're trying to, on the surface, say that they're protecting people with pre-existing conditions. But we know in real life that what they would be returning people to is health insurance that is incomplete, doesn't cover all the essential health benefits. It took a national law, the Affordable Care Act, to create real health insurance with a standard set of benefits to protect everybody, including people with pre-existing conditions, and this is a way of eroding that. So basically our assessment of what the Senate is doing from what we're hearing is that it looks very similar to the amended American Health Care Act passed by the House, and that this is dangerous for Medicaid. It's dangerous for people with pre-existing conditions. It's not an improvement. We think there will still be millions and millions of people who lose their health coverage. And basically, this is like trying to put ketchup on rotten meat. It's not good. It's not healthy. It's a lot of just, I think, being disingenuous about what's happening. And so we feel like people should go ahead and take action and start letting their senators, our senators, and others know that they're opposed to repealing the Affordable Care Act and cutting Medicaid through the American Health Care Act. The actions that we think that Illinois residents can take are two things. One, we have Governor Rauner, who is a Republican governor in Illinois, and Illinois is a Medicaid expansion state, so we stand to lose a lot. And we think that people can contact Governor Rauner and ask him to be really strong and really clear with the Senate and join with other governors from other expansion states in opposing the American Health Care Act or the Senate's version of it. So that's one thing. The governor actually can have a lot to do with this. Another thing that people can do is they can contact our senators in Illinois, Senator Durbin and Senator Duckworth. They are pretty strong advocates for the Affordable Care Act and for the Medicaid programs, but they still benefit from hearing from their constituents and will stand up and fight for us if possible. But we really want people to be active around this. It's really, really important. And what's the time frame again for the Senate's bill?
So they're looking at rushing this through right now. Mitch McConnell has said that he would love to get a vote by June 30th. I don't know how feasible that is. Other senators don't know how feasible that is, but they are willing to kind of push that deadline into early July because they are really excited to get to work on other things like the looming debt ceiling. So they're really trying to push this in. Again, I think they are trying to contact the CBO, but June 30th and early July is kind of when they want to have a vote on this.
Okay. And did you have a quote from Senator Cornyn?
I have a wonderful quote from Senator Cornyn. He's like, "It's like having a baby. It's not here yet, but it's coming." So even the senators themselves are really just not sure when this is happening. They're trying to rush it in, and they're trying to get these other senators to get to a yes, because that's really what they're waiting on. They're not really waiting on a CBO score.
Yeah.
They're waiting to get these other senators who've kind of been on the fence about it. They're trying to get them to yes, and then be able to schedule a vote as quickly as they can to kind of not miss that window of opportunity.
So this is very dangerous. The fact that they are considering a bill like this is extremely dangerous, and so we just really want to implore everybody to be activists, help inform other people about what's going on, and get them active. And we just can't let up. This is the fight for our lives. So thank you for watching once again.
Thanks.
Bye.